These are some patients at the Cancer Institute receiving chemotherapy, which is administered through IV or drip. The institute receives 35,000 new cases of cancer every year, and about 40% of these are cervical cancer cases. In 2021, the Cancer Institute embarked on a 350 billion shillings project to build and equip state-of-the-art treatment centers. So far, the first 65 billion shillings phase is more than 70% complete. 2 linear accelerators have been delivered and are awaiting installation. The 3-phase positron emission tomography PET project involves modifying and redesigning the bunkers for equipment, installation, and purchase. The holding center is complete. The necessary computers that are linked to the various cancer machines, like the linear accelerator, are in place.
The patients that come in here have received CT scans, MRI scans from the institute and outside the institute. We import the images to the various computers that are in here, and then the doctor contours the diseased area and the normal organs. And thereafter, the planning team, which comprises of the physicists and the radiation therapists, plan the patient, put the adequate fields that will be used while treating the patient.
The hospital is using one accelerator with the latest technology. The other 2, which have already arrived, are yet to be installed. The machine uses external beam radiation treatment, as Dr. Ausi Kavuma, the principal medical physicist at the institute, explains.
The linear accelerator uses X-rays and electrons. Those cancers which are closer to the surfaces, we treat them with electron beams, whereas those which are deep-seated, we use the X-rays, because X-rays can penetrate more deeper than electrons.
This is the accelerator head of the machine. What it does, it's like the treating component of this very high technological machine. It emits multiple energies, and those multiple energies depend on the weight of the patient. If the patient is bigger, then that means they emit more energy so that they can treat the affected part. What is more advantageous with this machine compared to the older one is that it is more precise in dealing with a specific part of the body that is affected with a cancer.
One of the arms is where the X-ray tube is. Another arm captures the digital image. And after you have captured that digital image, it can be aligned to make sure that the affected area or the cancer area which you want to be treated is in the middle of where the X-ray beam is going to target.
This patient is undergoing treatment for prostate cancer. The treatment, administered from the control room, targets a specific section of the body that has the cancer.
Another capability is that it can treat a much larger field size compared to the Cobalt-60, and the dose rates are much higher compared to if you compare the treatment times is much faster with the linear accelerator compared to the Cobalt.
In the past, patients have had to wait up to 3 months for their doses, and yet some of them are already on treatment.
The longer you wait, even the stage of the disease might increase.
The machine treats about 60 patients every day because of its more precise technology. Installed in the treatment room are the safety features, like an intercom equipped with cameras and a speaker, which allows the technical team to interact with the patient, and the last man out button.
If it's not pressed, the radiation can't work. It helps to make sure that there's nobody other than the patient is left in the treatment room.
Formerly, the institute was using the Cobalt-60 machine donated by India government, which has been functional since 2019. At least 120 patients are attended to every day. Each treatment course takes between 5 to 6 minutes. The treatment for cancer takes 4 to 6 weeks. Solomon Tendo is the radiation therapist who has been operating this machine for 3 years.
Before this machine, we had only one machine, which is in New Mulago down there, and as you can imagine, it was pretty constraining, because, as you know, you work on the same patients for a full month. So it means the waiting times for any patient to get onto the machine were pretty large.
The improved capacity being installed will make Uganda Cancer Institute one of the best in the region and is hoped to be able to increase the number of recoveries. The institute is also building capacity to produce nuclear medicine and install machines that detect cancer in the early stages. In the next story, NTV looks at the progress of the other sections of the PET, especially the significance and economic value that comes with the project. Sudhir Ruhanga, NTV.